Hey, welcome to my group's presentation here for our evidence-based practice class. Ours was on animal-assisted interventions for the treatment of patient pain. Group members here, Rebecca, Delcy, Phil, and Weston, and I'm the voice you're hearing attached to this PowerPoint. I'm Cole. With that being said, let's dive into our evidence-based practice presentation. First off, a little table of contents. I'm going to work really hard not to read the slides to you directly, so please go back to the table of contents to kind of figure out parts you want to review or take another look at. Um, Little introduction here to kick it off. Uh, Kind of how we decided to look at animal-assisted interventions for pain. This group put together here, we're all nurses already working in the field. Um, we work in a couple different hospitals, some a little bit more rural, some a little bit more quote unquote urban for the Coeur d'Alene area, I guess. Larger, maybe I should say they're a little bit larger, but either way, we decided trying to look at something that all of us have in common, and that is pain management, and look into at alternatives for narcotics as we've um, noticed, witnessed, had life experiences with um, people who've had too much exposure to narcotics. And so we found animal assisted intervention for pain treatment as something we could all agree to look into, and we were all interested in because who doesn't enjoy animals in some way, shape, or form? So that really kind of guided us for why are we looking at pain and why are we looking at animal intervention? Before we can really talk about the animals, we're going to talk here a little bit of background information on pain. Hospitalized patients frequently experience unacceptable levels of pain despite usual treatment, which impacts both the patient and the healthcare team. Non-pharmacological interventions, including animal-assisted interventions, which we will refer to as AAI sometimes, are becoming more widely recommended as an intervention to be utilized in the inpatient setting. Unmanaged pain can hinder recovery, resulting in extended hospital stays, diminishing patient comfort, decreased trust in providers, and overall dissatisfaction with the care that they receive. Um, One study here, I just want to make a note, found that more than half of patients in the hospital setting report experiencing pain, and that was of 2023. So, for whatever patient load you have, med-surg, ICU, PCU, expect half of them to be being treated for pain in some way, shape, or form. And while we have improvements in pain management with DCA pumps, nerve blocks, there has been a big push or more of a push for non-pharmacological interventions. And those pushes for non-pharmacological interventions are kind of coming from the significance and the impact that pain is having, not only just in the hospital and in treating patients in the inpatient setting, but just kind of on the United States as a whole. Um, you'll see that we found another recent study. This one was a year older from 2022 that showed that 62% of inpatient patients experienced pain during their stay. And this pain was significant. 22% of those ones, of that 62%, experienced a pain level of 7 out of 10 or greater. Um, Pain may be the oldest medical problem that we have. Pre-Incan cultures used coca leaves to manage pain. Hippocrates acknowledged opium treats pain. We're looking now so more into non-pharmacological measures to treat pain because pain is viewed as a complex entity requiring the individual and uh, treatment via a multimodal approach. There's been a couple things that have led to this non-pharmacological intervention, including the opioid epidemic, the growing recognition that traditional pharmacological treatments offer relatively little pain relief in the long run, patients' dissatisfaction with traditional pain care approaches, and the reconceptualization as pain is not a physical ailment, but a complex, multidimensional issue requiring a psychosocial lens. So, because pain is getting more complex, we can't just throw opioids at it. We've got to have some other alternatives to look at. One thing I found that was interesting is that pain is now the leading cause of disability worldwide. And I know you're looking at the studies there from 2012 and 2015. Yes, they might be a little bit more on the outdated side, but their findings are significant and are still kind of being used as the benchmarks right now of we have to treat pain to help with HCAHPS, and that's important on the inpatient setting. And we also, as a country, should be working to treat pain because we lose 560 to $650 billion annually, um, just from lower productivity due to patient pain. So now that we have looked at pain and why is pain significant as an area that we should be focused on treating, we can look at why we decided for those non-pharmacological measures, we have decided to look at animal-assisted therapy. Um, it kind of goes back here that some of the earliest medical texts describe positive outcomes from interactions with humans and animals. The symbiosis between humans and animals extends to primitive times when some mammals were viewed as protectors, companions, or even gods. Throughout history, animals have played an important role in the lives of humans, be it simple companionship or more recently as a form of therapy or therapist. In regards to nursing specifically, way back in the 1860s, Florence Nightingale commented on the positive impact that small animals can have on those with chronic illness. Since then, human health benefits from exposure to companion animals has been very well documented. Uh, Going along with more background information here, just that our guy Hippocrates, who also commented on pain, him and Galen both prescribed horseback riding. So an animal intervention, they both prescribed it. Uh, this is way back in ancient times. Galen did it for preventing disease, and Hippocrates prescribed horseback riding for insomnia. Just so we're all on the same page, our group is defining animal assisted intervention as the introduction of an animal into the immediate surroundings of an individual or a group as a medium of interaction with a therapeutic purpose. Um, some definitions of AI are way more intense and focused, um, where the animal has to be present in scheduled interviews and prescribed by a provider. We're not going that far there with ours that had to be prescribed or described. That wasn't part of our research at all. Last thing, just to touch on the history of animal assisted therapy, AI was used to promote social skills outside of the hospital. Some of the earliest dates of AI in the late 18th century, where animals were introduced to mental health institutions to enhance social interaction among patients. But more recently, in the inpatient setting, AI has been looked at as a tool to lower anxiety, stress, and pain. Some argue that this is all through the mode of distraction. And so instead of directly the animals are helping you, it's just because you're distracting the brain to think about something other than the pain. Um, this is kind of being debunked as some studies have looked at cortisol levels and salivary IgA samples post AI to determine that there is actually a physiological decrease to at least anxiety, if not pain, um, just by using these animals. Let's move on. And here we can move on to our PICOG question here. So, in hospitalized patients, how does animal-assisted intervention compared to standard pain management without animal-assisted intervention affect pain perception during the inpatient stay? Um, we found 16 studies to look at for this. You'll see we had 5 level 1s and 5 level 2s. So of our 16 studies, 10 of those came from level 1 or level 2, which led us feeling pretty confident that we could get a decent amount of information and background information about animal assisted intervention in the inpatient setting. 19 came from Side Hall, We had 122 results. I'm not exactly going to read to you everything here on the database search. So take a look at where our studies came from. How did we decide if we were going to keep stuff? It was kind of based on the relevance to our PICO question and the evidence level. Um, we did have to include some studies dating back to 2017 due to the relevance of our project. Um, yeah, I guess I can say that while were a fair amount of stuff to find, it wasn't the most overwhelming search we've ever had. Here comes our SMART goals. Um, just remember that the S is for specific. So we're specifically trying to reduce patient pain to aid in the healing process. We are using animals to reduce the pain. Measuring what we're measuring on, we're measuring the pain levels using some sort of established scale. Ideally, with all of our patients here, we'd be able to just use the FACES pain scale, the FPS. That's the one that has a bunch of faces on it. You can ask, well, how do you feel? And there's also a number associated with it. So one of those two. A, which is achievable. Um, like we thought we could lower pain for at least one unit in the hospital. Basically, like we're just rolling this out on one unit. That's the one unit we want to focus on. R is relevant. So yes, this stays relevant. Aligns with our goals to provide patient-centered care, reduce the opioid use among patients, and to promote non-pharmacological pain management strategies. Um, Time bound, I would reevaluate the effectiveness after 6 months. Some continuation points here on top of our goals. We're just really trying to look here that AI has been used to impact a variety of health outcomes in a variety of populations. It's been looked at for more acute findings like pain, anxiety, and distress, as well as um, just overall enhancing patient satisfaction. Also just want to point out here that there are still some gaps in the literature. These experiments are really hard to replicate and really hard to standardize throughout, partially because there's just a lot of variation with people and their response to animals and what patients are or aren't appropriate to see animals. Um, on top of how hospitals are able to set this up get this used because unlike a lot of other factors that have a lot of variables you can't control, it's more difficult to get a grasp on how the animals and the patients are going to respond. To our synthesis of the evidence, AAI here had a broad purpose. A lot of studies were just looking at how AI can improve patients' well-being. And this could be just looking at anxiety and distress. This could be looking at maybe lowering like vital signs to kind of look to see if that helped out with their pain or their fear. Um, I'm not going to read these slides to you again throughout. These ones are a little bit more dense. A lot of good writing on here, a lot of things you can look at. One thing we did appreciate here was looking at the cost effectiveness of AI, and we touch about that later when we make our recommendation as well as it was nice to see that AI had impacts on a wide variety of patient populations. Um, a lot of the designs were similar. It had to deal with some sort of animal being brought into some sort of space to see if that made a therapeutic difference for the patients. They were then trying to measured it just based on patient response and scales and surveys, and others looked at very specific biomarkers to see if AI was helpful in that way. Most of these focused on dogs or mammals in some way, but there was one that did a turtle and goldfish. Um, Again, talking about samples, it was nice to see that AI could impact such a variety of people. Because of that, also, it's hard to say if AI is or isn't more beneficial for one group. Um, Lots of stuff touched on pediatrics because pain in pediatrics is a massive thing that hospitals are always trying to correct for, on top of more traditional stuff like oncology and patients in that area or stressful environments like the ED or urgent cares. The findings here I will comment were a little all over the place. A lot of them did say that there were statistically significant improvements for patients in whatever they were measuring, fear, vitals, pain for some of them, um, that patients did like AI and thought AI was beneficial to them. However, significant, yes, statistically significant, but when you're looking for things that really impact patient well-being and trying to improve patient outcomes, was AI something that you could absolutely recommend? Some of them didn't exactly live up and show that. um yeah, and again, you can read through here to see that some of these analyses were really helpful in finding aspects AI helped, and others were not. um That does lead us here to some of the implications we can point out too, though, that AI can be used in conjunction with other pain management strategies for patients who are amenable to it. Um, Pain must be assessed before and after to kind of set a baseline establishment. And again, after the AI intervention, it's important to get another assessment done. Good news is it is safe for those who aren't allergic or fearful of animals being involved. And again, kind of going along with the findings, it was hard to say if every study pointed to AI shouldn't be in the inpatient setting or should be, kind of just based on I think what the facility has going on and how many resources it has available. Referring to limitations, the most commonly cited limitation was the small study size. Um, some places had fewer than 100 participants they were evaluating. Selection bias and heterogeneity were also frequently noted due to the studied population, diagnoses, treatment, and location. Um, it was hard to find if the animals were helping or if people really just like the animals themselves. And lack of control groups was another factor in some studies. Just by that, we meant, was the control, like, what did the group that didn't get the animal get? Were they just told to relax? Were they told to read a book? There wasn't just one set control to compare AI versus something else to see if it was helping the patients. And of course, language barriers were there. AI has been tested globally, and we were only using the English language articles we could access. Okay, so based on everything we've done so far, looking at pain, looking at AI, the history of it, looking at what our synthesis of all of our articles did say, here is what we would recommend for the hospital inpatient setting. First of all, we do recommend that we use dogs. We recommend here that the time being recommended that the animal handler interacts with the patient is somewhere between 15 to 20 minutes. It did seem like just a quick pet and go didn't have the same outcomes as having the dog in the room for a little while. Um, so how do we get the dog to be in this space for decently extended period of time? I mean, 15 minutes in the entirety of a day isn't a ton, but 15 minutes when the dog has to go see multiple people can kind of feel like an eternity. On here to our recommendation. So the focus here of animal assisted intervention program is to facilitate patient interaction with the therapy dog and the handler. A couple things out off of this slide we just want to point out. Participation is entirely voluntary. It is the nurse's job here. They are responsible for using their professional judgment to assess whether a patient is appropriate and would benefit from the interaction with the therapy dog. It's twofold. The patient has to have pain that they're having a hard time managing here, on top of they need to be appropriate for a visit from the dog. This intervention isn't going to work for all patients. Hopefully, the nurses could assess and recommend patients that are alert with it, and also again aren't going to be opposed to having a dog visit them or another person. Um, Our recommendation here is not to use AI as any sort of substitution for narcotics straight up, but that this is to reduce the patient pain perception further. We can't, based on all the evidence we had, say that this is a fair multimodal pain uh, intervention to use that would straight up help lower narcotic use. Maybe it does, but it's just something you can add in for those patients that have hard to deal with pain. All right, with our recommendation in place, then it's about how do you get AI into the facility? How would you make this work for your inpatient setting? Um, we recommend trying to get AI started here on one floor before going hospital wide. Um, Really, here we want to touch on that it is two key components, and then we'll get to how the nursing staff and everyone else are involved here. Um, Here, I'm gonna go to the next slide because I like looking at this here first. So you need to identify key participants here, which would be a nurse champion for AAI, similar to how other nurse champions manage falls, strokes, and central lines. Though this one would be way more fun to be the nurse champion of. So this would ideally come from a unit that frequently handles some pain management issues, maybe oncology or orthopedic, but any med surg unit would work to begin this rollout. So you need the nurse champion on the nurse's side, and then you need to have the volunteer manager. Now, plenty of hospitals have volunteer programs set up, so whoever is in charge of the volunteer programs would be the person you're going to reach out to here. Um, the volunteer manager is focused on recruiting the therapy dogs and the handlers. Some things we want to touch on here about the therapy dogs themselves. Defining a trained dog for animal assisted intervention can be really vague. These are therapy dogs, they're not service animals. So there's not like an official certification that exists for therapy dogs, but the American Kennel Club offers the Canine Good Citizen test. And that is something that these kind of dogs can, these therapy dogs can have kind of in their tool belt or as a recognition of status, and that can kind of let you know you're dealing with some dogs and handlers who have done maybe a little bit more rigorous training. So as you're working to reach out with the nurse manager to be like, where do we get these dogs? I would try to find therapy dog groups in the area that are recognized by the American Kennel Association and maybe have passed this canine good citizenship test to start. Um, little comment here too, outside of once you have the dogs and you have the handlers identified, there's going to need to be some acquisition of liability insurance, just in case anything happens. I don't really want to get into the whole insurance side of it. I don't think any of our interventions really talked about massive risks with the animals in the hospital. Um, None of them commented on any patients being hurt by the dogs in any way, shape, or form. And we're going to assume under the assumption that these dogs are very good boys that we are using. So once the dogs and handlers are identified, the next step is to set clear expectations for time commitments and interactions in the inpatient setting. Ideally, here you could have three or four dogs and three or four handlers be available. And we would really want to start the initial rollout here where the dogs are coming around on the unit here, maybe for just an hour or two at a time. The volunteers will be encouraged to visit on the weekends, but if you can just really get them there Monday through Friday when a lot of procedures and stuff like physical therapy, wound debridement, dialysis are happening, that would be ideal to start. If you can't get enough handlers to commit to some sort of 2 hour block every single day, going for a Tuesday, Thursday, or Monday, Wednesday, Friday schedule would work as well. Uh, and then again, here we're trying to have the dogs and the handlers visit for 15-minute sessions, and we're really focused on 15-minute sessions and a 2 hour time frame so that we can protect the dogs and the handlers. Um, that would really be seeing like 8 patients in a 2 hour block, depending if the dog just went from room to room to room and didn't have any interruptions. We're being very mindful that we're not overworking these dogs and or the handlers themselves. So continuing on here with our implementation, once you have dogs and you have handlers and you have kind of the time commitment that these handler volunteers are going to need to make that the nurse volunteer manager is organizing, It's about what are they going to do when they come into the hospital here. So luckily, the dogs are already trained therapy dogs. We don't have to train them on how to be specific hospital therapy dogs here. Maybe they already have that as another little piece of recognition. If so, great. If not, that's okay. Um, we do want to train the handlers a little bit for what they're looking for inpatient wise, because we don't want AAI, this free therapy program that we're working with, to be in the way of the staff that's already here. So, trying to recognize interventions that they should avoid. Should they be planning around something? Do they need to wait or not see a patient for that day based on what's going on? Um, we really just need like a training session with all the dogs. We can do this off campus and wherever the dogs shelter area is located. We need training to cover how the handlers will introduce themselves and their dogs to the patients, how to ask the patients if they would like to pet the dog or have the dog sit near them. Again, we're trying to go for some sort of meaningful interaction with the dog. That is what all of our best data showed, is that when the patients could actually have some sort of dog interaction, that's when they had the best results there with pain management. And we could also go with how to handle situations where the patients decline the visits or prefer the dog to stay really close to the door, maybe far away from them, but they would still like to see the dog. Um, and what to do here, because we are emphasizing to them that yes, we do want it to be for 15 minutes, but that if the visit has to be cut short, that's a okay too. There's no like they have to stay there. I don't want the handlers or the dogs to feel pressure that they have to make this full 15-minute commitment if they or the dogs cannot do it. Like I said, we need the training to take place offsite the therapy dog's location. And once we have the dogs trained, once we have the dogs organized, now we can go to how do we prepare the staff to have um, some dogs on the unit here. You have your dogs and you have your nurse champion. We need to know who these dogs are going to see, and that kind of comes down to how we educate the staff here. So the nurse champion will work to educate the unit staff about AAI, its benefits, and the specific rollout plan. This education can be done through a 15-minute in-service over a 2-week period. So hopefully your nurse champion doesn't have to show up for too much of a commitment, can be at work, try and get some in-services done, have a packet available, and have some information about why we're doing AAI, who the dogs are, who the handlers are, and some clear guidelines such as AAI is not to interrupt care, but should be available as an addition to some other pain management options, and that this is appropriate for patients who are alert, appropriate, and could benefit from some extra anxiety management, pain management, overall well-being by having a visit from the dog. We also really need in this education that staff know how to alert the nurse uh, champion about what patients are appropriate once they've been identified. This can be done a couple ways, of course, because there's no one fail-safe. The nurse champion or the handlers need to be aware about maybe some dog-themed magnets that are outside of the room. We're just trying to have something outside of the patient room that identifies that they are appropriate and would benefit from AAI. I know at the hospital I work at, we have magnets that indicate like fall risks or MPO, and we could maybe have a little dog one there as well. For hospitals that don't already have that, the RNs could notify the champion via email or another internal messaging system. And then also, as a failsafe, we'll make sure we have a clipboard at the front desk. Um, and we have an example of what information is going to be on that clipboard coming up, but that will have patient room numbers that can be included. So make sure it's not HIPAA violation or anything, just the room numbers about who these dogs can also see. Also, before these dogs officially come in, we would love to have a dog parade on the unit, meaning we just bring in all the handlers and they come through for one little block, let the dogs sniff around, and then head out. Now, it can be way too chaotic with too many dogs. We totally understand breaking this up into maybe a couple different dog parades, but just so everyone's aware of the staff, the handlers, and the dogs that will be making a quick visit to the unit for some 2-hour session here every uh, couple of days, or ideally every day. So how are we going to evaluate everything we just talked about? Evaluation wise, we're want everyone to remember that this is an optional multimodal pain management tool. It is not essential that it does work for every single patient. Um, and what matters is that some patients experience better pain management using this, and that it did not create an additional burden for any of the hospital staff that are presently working, and it did not create any more financial hassles for the hospital because we did this all through some volunteers. So, yes, we would like to tabulate pre and post AAI pain scales. Ideally, we would use the faces and the numerical pain scale, and that's already assessments that are being charted in patient flow sheets. However, hospitals are tabulating those, and we would like to make sure those are trying to be done for AAI before and after the intervention to see if pain went down at all. We also really, on a more informal note here, are collecting data on from the spreadsheet you can see there on the screen of who are the handlers involved, what dogs involved, what unit are we on, what room number are we visiting, is this a repeat visit, and was it able to be a complete 15-minute visit? Um, the reason we want to look to see if this was a repeat visit is to see if patients are, yes, asking for the therapy dogs to come back multiple times because they're working for them, and also if the 15-minute visit could is being able to be complete in any way, shape, or form. If we have to change those guidelines later, we would like data for that, but we also know that just from best practice, we're trying to complete a 15-minute visit. Um, on top of those data pieces, these are the sheets that we were talking about on that last slide too that we would collect, and you could add room numbers too, so that therapy dog handlers knew when they came up to the unit who else they should be seeing. But um, we also really need to follow up just with staff. The nurse manager, sorry, the nurse champion can be following up with staff just about, are there any barriers to the AI program or the handlers? Is this working for you? Did you have any uh, s- situations where it didn't work or it wasn't beneficial at all? Or successes, of course, we would like to have those celebrated as well. Um, the nurse champion here can review the pain assessment scores, track the number of repeat visits. You can just do a broad evaluation of HCAHPS on the unit. Of course, that's not going to tell you directly if AI is or isn't working, but if you start AI and you notice that HCAHPS have gone up some percentage point, that just might be one extra data point to sell to your unit managers that, hey, if we're just trying to get these HCAHPS to go up any way, shape, or form, maybe having AI on the floor would contribute to that in some way, shape, or form that's meaningful. Um, yeah, that's how we're going to do some evaluation on this. Moving on here to our Cotter change model. These 8 steps. So, creating a sense of urgency, we're going to emphasize the need for non-narcotic alternatives for pain management. And also emphasize here that therapy dogs provide a safe, effective way to support pain relief without relying on medication and also keeping the costs down. Are forming a guiding coalition here, step 2. The core team should be made up primarily of main registered nurses and a nurse champion volunteer manager. Um, and of course, on the volunteer manager side, we're also going to need like probably one champion main therapy dog that we can coordinate through to make sure that they're still recruiting other therapy dogs and everything. The volunteer manager will recruit the dogs and handlers, ensuring that all therapy dogs have passed the AKC Canine Good Citizen test before they start. 3, building a strategic vision. We need to create a clear vision for the future, focusing on stronger community engagement, increasing HCAHPS scores, greater patient trust and comfort, and decreased patient pain with some reduced narcotic use. Uh, 4, recruiting our good volunteers. Um, it's probably always going to be a struggle here to actively recruit therapy dog teams. It's going to require sending out flyers, having the nurse volunteer, or not the nurse volunteer, but the volunteer manager doing a lot of community reach out. And maybe to encourage participation, we offer incentives like raffles for some gift cards after a certain number of therapy visits are completed for the therapy dogs. On top of just celebrating these therapy dogs, making sure that they have plenty of treats and pieces of equipment and clothing for participating that all good boy dogs like to have. Um, we can finalize those good old raffle details as you really start rolling this out. 5, removing barriers to change. So, yes, on top of like the insurance issue about how do we ensure that we don't have any jaws moments between these dogs and these handlers. We also just want to make sure that the work of the animal therapist and the animal can be exhausting and debilitating. So we need adequate rest and stress reduction measures to be utilized. Facilities and handlers must adhere to the published standards for humane use of animal-assisted therapy in all healthcare settings. We're just going to follow the standards that are already in place there. Um, we also need to ensure dog cleanliness with mandatory grooming within 24 hours before each visit, generating some short-term wins, capturing patient feedback by having the volunteers record positive comments about the therapy dogs that we can put somewhere on the unit, even just on maybe the big whiteboard coming into the units or whatnot, if your unit has one. Making sure we're sharing these quotes with the nursing staff and the support staff that are available. And we can also there post some pictures of the therapy dogs around the unit so that staff and patients become more familiar that these dogs are going to be part of it and visiting. Sustaining change is a continuous process. We would really just start here on the Nurse Champions unit, but have plans to expand to every unit that eventually every unit could have a Nurse Champion. Every unit can have their own group of therapy dogs, and trying to put this into Kootenai's DNA. It would be awesome to form a group of therapy dogs for our hospital called like the Kootenai Therapy Dogs, and having their own little vests, and just having the therapy dogs be more entwined to Kootenai by having their own little Kootenai grouping and Kootenai identification. How are we gonna tell our project findings to the world here? Options through the journal submission, the Journal of Pain Management of Nursing, conference presentations, the American Nurses Association or Pain Management Nursing conferences, um, continuing ed opportunities. We talked about how we really need this to be like some sort of little in-service and 15-minute chunks for a 2-week span. Um, this could absolutely be something that nursing councils get to have and shared governance as they try and pick a new nurse champion. And just knowing our target audience here, bedside nurses, again, that's why we're emphasizing that uh, this is to just be out of their way and just to be a asset that they can use for patients that would benefit from it. Oh, man, in conclusion, animal-assisted interventions offer a compassionate, practical approach to managing pain in hospitalized patients, especially those unable or unwilling to use traditional pain medications. Evidence supports AI's role in reducing pain and improving patient satisfaction, making it a valuable addition to our pain management strategies. Effective implementation, staff training, and evaluation are crucial for success with AI, potentially enhancing overall patient outcomes holistically. We are encouraging this program to be done with minimal cost. Use as many volunteers, current staff, and the volunteer manager as you can. Um, what we really want to talk about here at the end, though, is that the finding of these studies with a lot of non-social controls indicates that some of the beneficial effect of the intervention may just be due to distraction, straight up social interaction with the dogs, or maybe just the fact that it's a novel situation still to see dogs in the hospital because it's not that popular. I guess it is popular, but not that popular. So while the effect of AI as a whole is high, it may be the case that AI is only superior to just no treatment at all or no other social interventions. So the fact that what makes AI beneficial then is that it is relatively inexpensive and easy to implement. And it may have an advantage over other types of therapies, even other socially based therapeutic interventions. So, with that in mind, health professionals and psychologists of behavioral medicine should consider still implementing and studying AI interventions in order to continue benefiting patients and examining whether it is beneficial above and beyond other interventions as well. As this is just another tool we can use in the tool belt, and it's an inexpensive one. And much like our group, who doesn't love seeing a good dog wander in the hospital? Staff and patients alike. Thank you so much for sticking through this presentation. I hope you listened to it on 1.5 speed there because it went really long. Shout out to my group. Great work, guys. Great semester. Everyone have a great summer.